This video will teach you how to generate a ticket to ride for your patients. A ticket to ride is to be used on patients that will be going from your unit to an ancillary department without the transport assistance of a licensed clinician. The ticket is a communication tool from a licensed clinician, such as the primary nurse, to staff in the ancillary department, and vice versa. This should give staff relevant information regarding the patient, such as their code status and the contact information for the primary nurse that is taking care of the patient. The primary nurse is responsible for completing the ticket and sending it with the patient. The ancillary staff, such as a radiology tech, can make any notes on the printed ticket and then send the ticket along with the patient back to the nursing unit. To make a ticket for your patient, you will first need to have their chart open. From the chart menu, select the option to add an order. The ordering screen will open, allowing you to type in "Ticket to Ride" in the search field. After selecting the appropriate order, you will then be prompted to enter in the ordering physician information, which will be the provider who had ordered the ancillary test or procedure. The communication type for all Ticket to Ride orders should be "No cosign required." After selecting OK and then Done, you should be directed to the order details screen. Even though there are only 2 required fields, which are highlighted in yellow, you still must complete any of the additional fields that apply to your patient. The information provided in these additional fields will assist in the safe transfer of your patients to and from the units. These additional fields include the sending nurse and phone information, noting if the patient is a fall risk, and including any mobility restrictions that your patient has. You should also add if the patient is currently on oxygen, and if so, how many liters they are on. It is also extremely important to note if the patient has been recently medicated and what their current code status is. You can add any additional information in the Special Instructions section, such as a recent glucose level for diabetic patients, or any other significant information that might be helpful to the staff, such as what the patient prefers to be called. After you have completed adding all the order details, you may select the Sign button. This will not only sign your documentation, but will also print the ticket to ride for your patient. Please note that the ticket to ride will automatically print on the nursing unit that the patient is currently listed in. This concludes the video on how to complete a ticket to ride.